Welcome to Prescribing Hope, Azithromycin Unmasked, where we are going to unpack the science behind the medicines that shaped COVID-19 fight. I'm your host Rittika, and today we are unmasking azithromycin, a drug that became a household name during the pandemic. Joining me is Saakshi, who is here to dive into azithromycin's safety profile during its COVID-19 use. Welcome, Saakshi.
Thanks, Rittika. Excited to be here and talk about this antibiotics wild ride.
Let's dive right in. Azithromycin was used widely during COVID 19, often off label. Our first question to you would be that what were the main safety concerns when azithromycin was used for COVID 19, particularly in diverse populations?
When azithromycin was rolled out for COVID-19, its safety profile was well known from decades of use for bacterial infections. However, its off label use in COVID-19 raised specific concerns. The primary issue was its potential to cause cardiac arrhythmias, particularly QT prolongation, which can lead to a rare but serious condition called torsades de pointe. This risk increases when azithromycin is combined with other QT prolonging drugs like hydroxychloroquine, which was common early in the pandemic. Data from observational studies like those in hospitalized COVID-19 patients showed a small but measurable increase in arrhythmia risk, especially in older adults or those with pre-existing heart conditions. Another concern was gastrointestinal side effects, nausea, diarrhea, and abdominal pain, which were frequent but usually mild. In diverse populations, we saw challenges with dosing adjustments. For example, patients with kidney or liver impairment needed careful monitoring as azithromycin's metabolism can be affected, potentially increasing toxicity. Finally, there was a worry about overuse leading to antibiotic resistance, though this was less about immediate patient safety and more about long-term public health.
Wow, that's a lot to unpack. Let me break it down for our listeners. So, think of azithromycin like a well meaning electrician fixing your house's wiring. It's great at its job, but if you're working alongside another electrician like hydroxychloroquine, things can get sparky, especially in the heart, causing risky rhythms. And with folks who have weaker kidneys or liver, it's like the electrician's tools aren't calibrated right. So you've got to watch closely. Plus, there's the stomach upset angle, like a bad takeout meal that hits you fast but passes. Sakshi, a follow up question that I can think of right now is were there any specific groups like older adults or those with heart issues where these risks were especially tricky to manage?
Absolutely. Older adults and those with heart conditions were red flag groups. Age often brings reduced organ function, so azithromycin's clearance from the body slows, amplifying risks like QT prolongation. Patients with existing heart disease, say a history of arrhythmias or heart failure, were particularly vulnerable because their cardiac systems were already stressed. We also saw challenges in patients on multiple medications, common in the elderly, where drug interactions could stack up. For instance, combining azithromycins with certain antidepressants or antifungals increased arrhythmia risks. Clinicians had to weigh these risks very carefully, often using EKGs to monitor heart rhythms before and during treatment.
Got it. So, extra caution for those already juggling health challenges. So, let's move on to the next question that I have is that how did azithromycin's safety profile hold up in real world COVID 19 settings, like outpatient clinics or hospital?
In the real world settings, azithromycin's safety was a mixed bag, shaped by how it was used. In outpatient settings, where it was often prescribed early in the pandemic for mild COVID-19, the drug was generally well tolerated. Side effects like diarrhea or nausea occurred in about 10 to 15% of patients based on post market surveillance data, but severe issues were rare. In hospitals, though, the picture changed. Critically ill COVID 19 patients, often on ventilators or with multi organ dysfunction, faced higher risks. Studies from 2020-2021, like those analyzing large hospital databases, reported a 1 to 2% incidence of QT-related arrhythmias in these settings, particularly when erythromycin was paired with other drugs. Drug interactions were a bigger issue in hospitals where patients were on complex regimens. For example, combining azithromycin with amiodarone, a heart medication, amplified cardiac risks. On the flip side, azithromycin's once daily dosing and short courses, typically for 5 days, made it easier to manage than some other antibiotics, reducing prolonged exposure risks.
So it's like azithromycin was a reliable car on a smooth road in outpatient clinics. Mostly safe, but with a few bumps like nausea. But in hospitals, it was more like driving that car through a storm with bad brakes, higher stakes, especially with other drugs in the mix. So, did doctors find a way to mitigate these risks, like adjusting doses or monitoring differently in hospital versus clinics?
Yes, clinicians adapted quickly. Yes, clinicians adapted this quickly. In outpatient settings, they leaned on azithromycin's standard 500 mg loading dose followed by 250 mg daily for 4 days with minimal monitoring for low risk patients. In hospitals, they got more proactive. Many started routine EKG, many started routine AKG monitoring, many started routine EKG monitoring to catch QT prolongation early, especially in ICU patients. Some adjusted doses based on kidney or liver function tests to avoid toxicity. Pharmacists also played a big role, flagging potential drug interactions before prescriptions were filled. For example, they would recommend alternatives to azithromycin if a patient was on high risk drug like, like amiodarone. These steps helped balance safety with the urgent need to treat.
That's actually pretty reassuring. Doctors and pharmacists acting like traffic controllers to keep things safe. So, what lessons about azithromycin's safety did we learn from COVID 19's usage that could give and guide future pandemics?
The COVID 19 experience underscored the importance of context in azithromycin safety. First, we learned that cardiac risk, especially QT prolongation, needs proactive monitoring when azithromycin is used with other QT prolonging drugs. This means routine EKGs and drug interaction checks should be standard in high risk settings like hospitals. Second, we saw that azithromycin safety in diverse population hinges on personalized dosing, which means adjusting for age, organ functions, and comorbidities. Third, the pandemic highlighted the need for clear guidelines in order to prevent overuse, which can fuel antibiotic resistance. Data from global health networks showed resistance pattern did not spike dramatically during COVID-19, but we got a wake-up call about stewardship. Finally, real-world evidence like hospital registries and outpatient surveys proved invaluable for tracking safety in real time, hence giving us a blueprint for future crises.
It's a powerful takeaway. It's like azithromycin taught us to be better detectives, checking heart rhythms, tailoring doses like custom fitting a suit, and keeping an eye on resistance to avoid future trouble. So, one last question. Are there new tools or protocols being developed based on these lessons to make azithromycin safer in future emergencies?
Definitely, Researchers are working on better predictive tools like AI driven models that analyze patient data to flag arrhythmia risks before prescribing azithromycin. There's also a push for standardized protocol, think checklists for clinicians that integrate EKG monitoring and drug interaction alerts into electronic health records. On the resistance front, global initiatives are strengthening antibiotic stewardship programs using real-time surveillance to track usage patterns. These tools aim to make azithromycin a safer bet in the next crisis.
Incredible. Science learning from the chaos to build a safer future. Sakshi, thank you for breaking this down with such clarity. And to our listeners, Azithromycin's story remind us that even a familiar drug can surprise us under pressure. But with careful usage, it can still shine.